It's Carl Lishing, a licensed insurance agent out of Lakewood, Ohio. I've been in the industry for over 25 years. Today, we're going to discuss how supplemental insurance can help work alongside Medicare Advantage plans. Medicare Advantage plans are on the rise with people enrolling due to the low premiums, the copays that they offer, the maximum out of pocket exposure tends to be fairly reasonable, the extra benefits. Many people find value in them compared to traditional Medicare with a supplement. However, there is out-of-pocket exposure on Medicare Advantage plans, and in some cases it can add up. Most of the copays are kind of small and manageable for the day-to-day things like doctor's visits, specialists, testing, urgent care, emergency room, therapy sessions. But then there's bigger copays as well, like if people end up in the hospital or if they need outpatient surgery. If after a hospital stay, if they're not ready to go home yet, and then they have to have a long facility-based rehab, what's called skilled nursing facility, those can add up quite a bit. For instance, like most of the plans what I've seen in Northeast Ohio, if the person's in the hospital, the daily copay, if they end up, it's usually between like $275 to $350 a day. And that'll go for the usually 4 to 7 days, depending on the plan. Then if they need outpatient surgery, that could be 175 to 400, depending on the plan and the carrier. And if they need skilled nursing facility for rehab, the first 20 days are usually zero copay, but days 21 to 100, they usually go to around $200 to $203 a day. So it can start adding up. Now, all these copays on an Advantage plan do go towards that maximum out of pocket. In our market here, and in a lot of markets, that max out of pocket is usually between $3,000 to $4,500 on a lot of the more competitive plans. It can be higher than that though, but it's usually someplace between $3,000 to $4,500 in the year 2024. Supplemental health insurance can be designed in a way to balance out these bigger copays up here. So if somebody ends up in the hospital and those things are adding up, there's products that will pay cash benefits directly to that member to help balance that out. Now, depending on how the benefits are structured, they can start around $30 to $35 a month. They can go up to around $70 to $80 a month. So if the person has a zero premium Medicare Advantage plan and they're looking for a little bit of an extra layer of protection at a reasonable price, that can be a decent way to accomplish it compared to the cost of original Medicare with supplements. Another area that I often see getting kind of expensive for Medicare Advantage enrollees is it's the thing that a lot of people don't want to think about, but we all know somebody in a lot of cases that has dealt with a cancer diagnosis. Now, with most of these plans, the member pays 20% of the cost until they hit that maximum out of pocket in that $3,500 to $4,500 range. If you're paying 20% of chemotherapy, radiation treatments, it's probably likely that that person's going to get there. However, with cancer treatments, those treatments go over months, sometimes years, and these maximum out of pockets are running on the calendar year, January 1st to December 31st. So if the person is still going through treatment the following year, Happy New Year, on January 1st, this $3,500 to $3,000 to $4,500 max out of pocket could very well come back. So when somebody thinks that they maybe had a $4,500 max out of pocket, that can turn into $9,000 fairly quickly. So another type of supplemental health policy that can be purchased by consumers is what's called cancer insurance. What cancer insurance does is it pays lump sum benefits directly to the member, as low as $5,000, and then it goes up from there. Usually someplace between $10,000 to $25,000 is an appropriate amount to help balance this stuff out for a couple of years. Premiums are very reasonable, starting around $10 a month to $30 in a lot of cases, maybe a little bit more in some cases, but they're very reasonable, and I think it's a good product to own. especially when we consider how many people deal with cancer at some point in time in their life. So if there's questions on this, or if you'd like to have a conversation, just call the number on the website, or feel free to click the button, book an appointment, and I'll be happy to help. Thanks for your time today. Bye for now.